Welcome back to YogaPodClass. Today I have a very special guest, Dr. Brenna Sokol. She is the founder and primary physician, physical therapist at Next Gen Physical Therapy and Wellness. So excited to have her on today. As we get started, I invite you here to settle in, feel your feet, feel your seat, take that breath, and join in. Today's conversation is exciting. I'm excited. Brenna's excited, and I'm gonna let her tell you why. We'll kind of just jump right in here. Brenna, what is the one thing you wish women, but humans, knew about their body and taking care of their body?
Mhm. Well, I think on the topic of what we're here to talk about today is that we all, both women and men, we all have a pelvic floor, and we all need to know more about our pelvic floors and know that they exist and know how to react to whatever our pelvic floors are telling us as well.
What did you all feel when she said pelvic floor? Did you notice your pelvic floor? Did you get a pit in your stomach? Right? Taking that moment to settle in and say, "Whoa, what? What are we talking about?" Yeah, our pelvic floors, men and women, we both have them. I have had such a fun journey. If you guys have been on the YogaPodClass series with me, we met with trauma-informed dental hygienist Katie Pudwell with Grow RDH, and she stopped me in my tracks and she says, "What does a relaxed pelvic floor feel like?" And I didn't have an answer for her. Thankfully, I was in schedule with Miss Brenna here, and we've gone through some of her protocols for what she does when women or men come in for pelvic floor issues. What are some of the most common pelvic floor issues? I mean, honestly, I think a lot of people would not think that they have pelvic floor issues, that some of the things like incontinency or sex, like hurting during sex, right,
Mm-hmm.
are normal. And are these things normal, or what are other dysfunctional pelvic floor
Yeah,
issues?
yeah. No, it's a very wide range of symptoms that people can have when we're terming the umbrella term of pelvic floor dysfunction. So that in and of itself, just I guess to start off the bat with, just to get out my own feelings there is I really wish pelvic floor therapy wasn't the term of the therapy in and of itself anyway, because we do so much more than just working with pelvic floor muscles. And a lot of these diagnoses include things more than just pelvic floor muscles. However, that's still kind of current terminology, and that's what we're using. A lot of times across social media, you're still going to hear the word pelvic floor therapy. But common diagnoses we really see that are pelvic specific range anywhere from incontinence. That's always the most popular one is, especially stress or urge incontinence. I'm coughing, I'm sneezing, I'm leaking when I'm doing those things. That's the incontinence side of things. Another big category is any of the pain diagnoses. So again, a big umbrella term because pelvic pain can mean 100 different things, and we can have pain in one area, all the areas. It can be very isolated, and it can be very specific, or it can be very broad and vague from a chronic pain type condition. So many different diagnoses in the pain category. And then we also have just a huge subset category of pelvic floor dysfunction in and of itself, which typically boils down to coordination deficits. And that a lot of times goes back to any of the orthopedic patients, um, chronic low back pain, hip pain patients, and especially prenatal postpartum patients who aren't engaging or relaxing their pelvic floor well and working it in a coordinated effort with the rest of their system. So it's kind of teams in with glute dysfunction and core weakness and things of that. They're all umbrella terms, but there's so much we can do from a therapy standpoint, and there's so many things that people come in for that their doctors finally refer them to. Hopefully that becomes more of a popular thing of providers knowing that we exist, but people will come in and I hear it commonly throughout every day of my work day of I didn't even know there was therapy for this. So lots of things to talk about today.
It's exciting. And again, tuning in with how this conversation makes you feel, somatic awareness. Any light bulbs going off, or me too, oh, and it's okay, right? We're here to have a little fun and lighten the conversation. Brenna, you mentioned about all of kind of that other areas, the glutes, prenatal, postnatal, and low back hip area. And you started in the orthopedics, right? And that's kind of what led you to where you are at today.
Yeah, definitely. In a joking manner, I tell people frequently that if you would have asked me 15 years ago back in school that I would be a pelvic floor therapist, I probably would have laughed out loud.
Yeah.
It's the stigma's gotten better over the years, but definitely 10 to 15 years ago, like pelvic floor was still very far out there. It existed, but it was like, oh, that's that weird stuff people do for like people that are peeing their pants. And 15 years ago, I didn't have any incontinence issues. So yes, I very much came into PT school and out of PT school in the beginning thinking that I wanted to work with the athletic population, the orthopedic world, and I still do so to this day. I did my residency and fellowship in orthopedics and manual therapy, so I still heavily treat that. And I fell into the pelvic floor world, kind of a twofold story. First, I was introduced to it in my orthopedic residency. I had a mentor that was seeing pelvic floor patients, and thankfully to her, she really normalized it for me. She brought it up and used it in her practice as a very conjunctive way where she was using it with other orthopedic things. And that was the first time that I'd ever really heard or seen that. And it just made a lot of sense. Again, with people who are coming in with hip issues or back issues, your whole pelvis system, any back or hip issue, your pelvic floor area is 1/3 of that equation. So if we're ignoring the pelvic floor chat with any hip or back patients, like we're really just honestly leaving out 33% of the issue right there because it's a whole third of that complex, if not even more. And then, so I was exposed to it there. I was a little less afraid of it, I would say, for simple conditions, for more of the orthopedic type conditions. And then I got pregnant and had my first child. And I had a lot of complications with my delivery. And afterward, I required a couple additional pelvic surgeries myself. And after that, I needed pelvic floor therapy, and there was no one to do it. I had to drive over an hour away. I couldn't tolerate sitting for an hour, let alone I mustered up finally going to the first visit over an hour away. And I really, unfortunately, just didn't get a ton from that. And so I took a deep dive and started taking classes because I realized how much of a problem it was. I mean, not to like put so much like toot my own horn type of thing, but I like went into pregnancy and out of pregnancy feeling like I knew a lot about my body. I exercised the whole time. I was already a practicing physical therapist, but with all the knowledge I had about the body and the anatomy and physiology system, I was still completely lost on what to do postpartum, what to do pregnancy, how to push, all of those things. Like, no idea. And I had no idea what to do for recovery either. And I was like, if someone like myself doesn't know what to do, how does anyone else know how to handle these things? So that really inspired, I guess, my initial deep dive into the pelvic floor world was more of the obstetric side of things. And I still love that world, but now I've just kind of slowly evolved into treating a little bit of everything with it. Yeah.
Brenna's super well-rounded and very ambitious. I love not only being one of her clients, but getting to do this with her. I went to her workout class on Saturday, and then we followed it with a yoga class, and it was just a beautiful pairing. I love when the physical fitness world starts to include that slow down. I mean, there's so much of that hustle and grind, push, push, push to get those gains, but then people plateau and then they get injured. Finding that time for the rest and recovery in that nervous system switch is a very fun balance. She definitely pushes me in amazing ways, but she's also like given me a quality of life back that I couldn't get on my own. I had my own yoga practice. I had my breathing practices, but there were, I mean, probably most notably were my traps. They were just rock hard, never laid down. I'd done everything from cupping, massage, acupuncture, so many different things, and chiropractic just to maintain. And it wasn't until, I'm not gonna lie, I was actually kind of biased against physical therapy. I had been to physical therapy before, and they're like, here's a heat pack,
Here's
will
some
you please do some
stretches.
exercises? And admittedly, was I doing those exercises at home? No.
Mhm.
But I wasn't sticking through, I like the pun intended unintentionally, but to what they were asking me to do anyway. Um, I came to Brenna and my traps have laid down, and I want her to talk about this. In you're free to disclose
Mhm.
my medical history here.
Okay.
Because Brenna, she talked about how things are all connected, and they really are. We started kind of working up in my back, and for a long time, I know with the dental hygienist with Katie, I talked about the TMJ and the clenching, and I had always thought that my upper neck and shoulders pain was going from the bottom up. But after I had needles in my face and everything relaxed in my jaw, my neck then relaxed. Why this is pertinent is because in anatomy, we actually have three diaphragms. We have our breath diaphragm right here that most everybody knows about. And I invite you to just take a time to just breathe with me. We're talking about some deep, layered physical things, right? And I'm asking you to tune in and check in with your body and just notice, right? Without judgment, just simple curiosity of noticing those spaces and places that are maybe tight to breathe. Where is it sticky? Where is it icky? And the other diaphragms that we have, other than right here, are in our jaw and our pelvis. So when we are getting release through the pelvic diaphragm, like she's released me all the way up. My last session that I had last Friday, literally, we were down in the pelvic bowl area, and my diaphragm let go, whatever muscles were holding onto that, and she's the doctor here, so I love that because I don't keep all that terminology. If you've listened to some of my other podcasts where I'm trying to make those pronunciations, that's not my first language, nor is Sanskrit, but I have fun anyway. So what's happening there? This is all connected. We've got our posterior chain, our legs are connected to our upper body through the psoas,
Mhm.
and when we release one area, I always cue it in yoga. Okay, when we open up through our heart space, that makes room to open up through our hip space.
Mhm.
Tell us in the doctor terms, what's
Yeah.
what's happening through all this, and how do you support that?
Yeah. So I know you work with a wide variety of people too, and I will just say to start with that there's a lot of different theories out there when it comes to the body and different practices. You look at chiropractor, PT, even yoga, all the things, like we all have our little niches and we all have a different theory that we're practicing and learning under. And there's a lot of different theories of evolution through the human body as well. Even you just saying like the posterior chain and lateral chain and all those fascial chains, it's a big controversial topic in a lot of these healthcare fields, because how much does it pertain to things, how much does it doesn't. But I've definitely evolved in becoming a little more holistic, and I think anyone who's not there yet is just honestly not there yet, because there's a lot more to these things than we even fully understand yet. And I will die on that hill that there's just so much about the body that we don't know yet. And that's exciting though. Like for me, as I'm still consider myself young, I still have a good 30 years left in practice at least. And that being said, like that gives us all motivation and hope for what's to come with science and evolution and what else we can learn about our bodies to help it better. But at the end of the day, I say all this because at the end of the day, I think everyone can agree that everything in the body is connected, and that does serve a purpose. And I think as simple as that sounds, it's so important. Like Chelsea was saying, everything's connected in us. Like if we're carrying and being tense up through our face and our shoulders, that tension's not just going to stay in our face and our shoulders. That gets carried through the whole body. Again, whether you're talking sympathetic, parasympathetic nervous system, it is definitely a nerve involvement there, but there's definitely chains and connections through our body that connects down. When it comes to these diaphragms that Chelsea was just mentioning, that's a huge kind of segue into the physiology of the pelvic floor world, because a lot of pelvic floor therapy is based on pressure management. And the essentially what that means is, how do we manage the pressure in our body? Our lungs are staying inflated, and they do that because there's a constant pressure inside of us. So I always like to refer to this in patients in terms of, imagine your body, like your whole trunk and torso from your throat to your pelvic floor. So where we eat food to where food comes out essentially is like a pop can, and it's a closed pop can. But with a pop can, we all have lived, I think a lot of people are probably listening from Midwest or even northern from there. Like things get really cold in the winter. You can't leave a pop can in your car. It's going to explode because pressure is a real thing with that. And same thing with opening everything. So pressure has to stay there, but pressure also has to be released, and it's an ebb and flow thing. So our pelvic floor is the base of the pressure, and with gravity playing its force on us as a body, and it has a huge responsibility in our body. So with that, our breath is a huge contributor to our pelvic floor system, because how we're breathing controls what our pressure is doing, and how our muscles are working with and against that pressure dictates where the pressure is going to go. So I can go further into that if you have specific questions, but I think I hopefully that paints, I guess, a clear enough picture that it's all connected here. Fun fact on that, I think we talked about this the one day, that it goes all the way back to when we were being formed as fetuses, embryos, that there is actually a direct connection between the TMJ, the jaw, and the pelvic floor. So that stems from the same. I'd have to really look up into my back into my anatomy books what the term was on what it kind of revolved from, but this same connection point split into that growth from what is now our jaw and what is now our pelvic floor. So there is like just really back all the way to when we were embryos, there's that connection that was formed there, which I think is super cool.
So fascinating.
Yeah,
absolutely. Yeah. And to experientially, I felt it. Brenna will tell you I'm very in tune with my body. So when we're doing, the needlework, I'm breathing into it, and really the other part that where the yoga ties in is that interoceptive awareness, mind body connection. There was so much that I was dissociated from, and it's like I had looked at anatomy charts and even the pelvic bowl anatomy of the muscles, but it wasn't until Brenna started putting literally her fingers, right, which she does an exam. This is an internal exam, and she's so gentle. I say that from a trauma informed standpoint. Like, I understand that this is this is a sensitive area, right? I experientially understand, and I commend you for even seeking any support in that area. No matter what traumas you have been through or haven't been through, normal pregnancy is going to shift your pelvic alignment. And having that support and recovery postpartum, I just can't imagine. But I'd like to imagine, women being supported in recovery and more postpartum rather than that, oh, well, they've been doing it for thousands of years. They've got this, right? Some of the conversations Brenna and I've had about um, even placement of like things like birth control, that there's a gentler, softer way, and that is the feminine way in a sense, and that can be really, really hard for a lot of us. And I know I'm sitting here with Brenna; she is a go-getter, I'm a go-getter, and it's like, how do we soften? How do we ease? How do we slow down, right? And really take the time to nurture and care for our bodies as our home, and that often takes support. If I could have healed in isolation, I would have done it, because I can't say that if you would have told me even a few years ago that I was going to let somebody put needles down there, that I would have been all about it. And there's a time and place. Now, there are other methods to this. I'm interested in your terminology, right? So pelvic floor therapy is a blanket terminology that we're using right now, but you do see it's going to shift into something different.
I
And what would
do.
you see that?
For a while, and still, the full board certification is called like a women's health certification, and that covers everything from oncology to pelvic floor dysfunction to like cancer patients, things in that world, oncology. Like even breast cancer, things like that, though, too. So women's health is definitely one of it, but that's not the answer either, because we see men too. Men have pelvic floors too. So I don't know. I don't know what the right word is. It's a great question, because someone else has asked me that too. After I gave them the same speech of, I don't like the term pelvic floor therapy, but I don't know the secondary option to it, but we need something better, just because it's not enough. It's not just the pelvic floor. Is where that creates the barrier at too right now, is patients and other providers are thinking that the pelvic floor is either 100% the problem or 100% the solution, which isn't always the case either. You know, in your case, like, yes, we did treat the pelvic floor a little bit, but not that much. Like, we treated a lot of the rest of the body, and what happened to the pelvic floor? Like, the tension changed there too. So we gave a little bit of love to it, but that was more so to build up your awareness than anything else. So it's not always inherently just a simple black or white answer of just the pelvic floor muscles being the problem, which in and of itself kind of segues to the other popular thing of Kegels.
Yes, yes, I knew this was coming. Yeah.
Kegels aren't bad. They're not the enemy. I feel like if anyone follows pelvic floor world at all on social media, it's a bit of a 180 of what it used to be. It used to be the world was like, do your Kegels, do your Kegels, do your Kegels. And some of the older school doctors still say that. Patients still come in and they're like, oh, my doctor told me to just do Kegels. But then that kind of switched a couple years ago when pelvic floor started getting more notoriety. I feel like with reels and everything, you know, there's just trends that start to happen with messages. And suddenly all I was seeing and all anyone else was seeing in our world was how people talking about how bad Kegels were. And neither are true. The truth is somewhere in the middle. Kegels aren't bad, but people need to understand what Kegels are. And all a Kegel is, by definition, is the isometric contraction of your pelvic floor muscles. So if you have your leg out straight, and you can do this and try it and it'll kind of make more sense to you, but if you straighten out your leg and tighten up your quad muscle, so you're pressing your knee down, tightening up your quad. In the therapy world, we call that a quad set. So a lot of post-op knee patients, their first exercise that they have to do, squeeze that quad, hold it for 5 seconds, relax. Squeeze the quad, hold it for 5 seconds, relax. And it's beneficial because what we're doing there is we're waking muscles back up. So a lot of times with surgery, with anesthesia, like things get sleepy, and activating that muscle over and over again can kind of wake it up. And that's a good thing. We want to be able to contract muscles, but that's all it is just that squeeze and contraction of the muscle. So again, it's not a bad thing. I want everyone to be able to do a Kegel. It's something I assess, like, can you squeeze your muscle? But the other end of that too is like, can you relax that muscle too? Because in the pelvic floor world, again, a lot of times it's tension issues. So maybe someone can do Kegels no problem. And we hear that a lot. It's like, gosh, I do Kegels 100 times a day and I'm still not better. I'm still leaking. Well, most of the time it's not because you can't contract it. It's because you can't relax it. And then even bigger on that is if you go back to the quad, cool, you can contract it. Cool, you can relax it. Can you use your quad functionally? And the same thing goes with the pelvic floor. Like, you would not rehab your knee by sitting here for months on end just squeezing your quad muscle. Eventually, you're going to be getting up walking, you're going to be doing steps, you're going to be doing squats, you're going to be loading that tissue. Same thing goes for with pelvic floor muscles. We need to contract, we need to relax. Now, can we contract and relax in appropriate and functional positions? Because that's how we live our life, right? Unfortunately, we don't sit here and we don't move in robotic ways either. We're up moving around, and we need our body to work in the ways that we need it to.
Absolutely. And with more ease. It's like getting older and having more pain doesn't have to be the status quo, right? We can age, and yes, things might feel a little bit more, I mean, what's the word? Like crunchy in the morning, right? But that's where another hot topic is the lymphatics, right? Getting into the lymphatics, rolling through the joints, waking up the fluids in our body. And just a simple change that I've recently incorporated for myself. I'm a lazy yogi, let's put it that way. Ayurveda medicine would tell us to dry brush. Well, that's an extra step for Chelsea, and we've got things to do. So instead of taking that extra step to dry brush, taking and getting out of the shower or bath and taking your towel and going up the body or towards your heart as you are drying off is just a simple switch that you can make, but it's going to trick your brain, right? But enjoy it, right? When we do new things, when we have new experiences, that's where neuroplasticity comes in. That's where we rewire, old habits and patterns, or even trauma injuries that root through the body. It really just that circling back to it's all connected. Kegels, yeah, I could do them, but could I relax? And I think for a lot of people in our society, men and women alike, we know how to go. We know how to push. You know, no pain, no gain, hustle and grind. But do we know how to downregulate? Do we know how to let our parasympathetic nervous system be dominant in activation? And that means rest and digest and repair. So then we can be more go and be more effective on the go by taking that time to come back and be present. I I love kind of the permission really to drop doing Kegels. Some of the exercises that I have people do for just getting into their pelvic floor is the yogi squat, where you're going to take and put your hands together, squat down, and your arms will go in the middle. And you can have a block or a bolster supporting underneath you. Uh, but that being said, that didn't cure the fact that I couldn't get my pelvic floor to relax. Uh, I'm very fortunate that I'm going to school also to become a yoga therapist. So in that, I'm allowed the opportunity to work with somebody who is a yoga therapist. And I'm like, well, I'm doing this in my PT world. You know, what can we do to match what's going on in my PT world? And I told her, I said, I don't have a problem with the activation. As my yoga therapist knew, she's like, oh, you don't know how to relax. I was like, there it is, there it is. And I invite you to do it with me here, just a few moments. You can put your feet flat on the earth or wherever you are. You can actually be laying down, but emptying out your breath all the way, pulling the belly button to the spine or holding the intention to do so. And then breathing in through the right sole of your foot, up the leg, up to the hip. And then exhaling across the pelvis, down the left leg. Your full inhale, your full exhale. We'll do 3 rounds each way. Breathing in through the right foot, up the right leg, knee, up to the right hip. Full, full, full. Then exhale across the pelvis, down through the left leg to the knee, down the knee to the ankle, out the foot. Again, in through the right foot, all the way full. Exhale, breathing across the pelvis, down the left leg, knee, ankle, toes. Finding either some movement, wiggle, and we'll set up for the other side, breathing in through the left leg, up through the knee, the upper leg, left hip. Exhale across the pelvis and around that right hip, down the leg to the knee, to the ankle, out the right foot. Exhaling completely, preparing for your next inhale up to the left foot, ankle, left knee, hip, across the pelvis, down the right leg, the right knee, right ankle. Exhaling out the right foot. And one more time, inhaling in through the left, all the way up to the hip. Fully breathing in as much as you possibly can, expansively. Then exhale, crossing the body, down the right hip, leg, knee, ankle, and out the right foot. Welcome.
Like, I'll take a nap now.
Right. That's the down regulation, right?
Mm-hmm.
Where we can be more present, less reactive. Another thing that Brenna had mentioned that I wanted to touch on was how we are this container and how our breath taking up shape inside of our body really affects the pressure inside of our container. And if you've been on this journey with me or heard it said in any other yoga classes, right, that reverse breathing where we breathe in and our belly goes to our spine and we're holding all of our oxygen up in our chest and heart space. That in itself is anxiety producing because it is going to tell our brain, hey, we're not functioning properly. We're not getting the right oxygen. Alert, alert, alert. And then that can feed and snowball into a panic attack, at worst. But at kind of the status quo is everybody has a baseline anxiety because we're not breathing properly. Our pressures are off. So taking that time to really touch in with your body and your breath and breathing expansively. If you're seated, pressing down into your feet in your seat, and then breathing in, filling up front, back, side to side, all the way up the shoulders, elongating the ears away from the shoulders, softening the eyebrows, relaxing the jaw, and then exhale completely, belly up into the upper heart space. Setting a reminder 3 times a day to practice that for 3 minutes, whether it be with your breath. What we did before that was a prana nidra, where you're imagining the breath going through your body. It doesn't have to be just through the legs. You could do it through the arms. You could do it up and down the spine. And those are just ways to shift your body into a relaxed state. And that can also be used for your patients, women coming in, men coming in. This isn't an easy visit, right? What do you see? What are the apprehensions? What are the roadblocks that even keeps people from coming in to explore this type of relief?
Yeah. I mean, sensitive subject, right? Like you said, it doesn't have to be, but a lot of patients that I work with are, prior trauma victims or people that have just experienced so much trauma in their life, whether it's connected directly to the pelvic floor or not. That trauma, again, is going to be a form of tension and anxiety and all of that stuff. So I always tell everyone it's a very safe space. You're open to share as much as you want. Internal exams are very helpful from my end, but they're never mandatory. So that's always good to know too. When you think about pelvic floor therapy, is that if you're not comfortable with, going clear into internal exams or internal work, that's okay. There's still a lot that we can do, just from an external standpoint. But I also jokingly tell everyone too, like there's nothing like TMI. The word TMI just doesn't exist in this room.
It's so true.
And I promise, like, I'm unfazed by it. I've heard and seen what I feel like is about everything at this point. And so nothing that you say or nothing that I see is going to be embarrassing to me. But with that being said, I still also honor and accept and appreciate that. Just because I say that, it doesn't make it any easier for patients that do come in, because it's a lot of vulnerability just from a society standpoint of talking about these things and admitting that maybe there is an issue or there is a dysfunction, that you might not want to talk about, or you might not, but hopefully you do want to address it, because hopefully we can make it better.
Right. And you're always going to hear me talk about the book written in the 80s about the body keeps the score. In yoga, they talk about the hips being the drunk drawer. This is where we shove the emotional and energetic things that happen in our life that we don't have the time, the resource, capacity, or space to handle and deal with. This is just one method of dealing with ourself. And our path to ourself is really what we're holding space for, to feeling best in our body. And our body is so much more expansive. We have the physical body that we're really working with now. In yoga, we call that the Anamaya Kosha. And it's all the physical things, the things that we can touch, the fluids of our body, and how it's intertwined to the energetics of us, the emotions of us, the intellectual layers of us, and our spiritual side of things. Um, that's kind of been the beauty of my path, is that I get to see and experience all of these layers, with Brenna, with the physical layer and the things that she's been able to reawaken back up. I had muscle disconnection even in my legs, that those muscles weren't engaged, so I didn't necessarily enjoy working out because my other muscles were taking on all of the load and not getting the support of the muscles that should have been engaged. And with Brenna's help, I've been able to enjoy working out even more, because it's like, oh, look at these muscles are coming to the show.
Mm-hmm.
They want to help, and they get a little bit sore because they're like, oh, we haven't done this in a really long time. But
It's good to feel things.
it really is.
Sometimes it's scary to feel things, but it's good to feel. Just like, again, everything. But
so much so, yeah. And that really is our invitation to feel things physically, emotionally, energetically, and be held in a safe and supportive environment. I love being an adult, I guess. This is adulting, right? Where you get to work with people that are really like women supporting women. And that is such a healthy, amazing vibe that I get from Brenna. If you don't know, Brenna has like, what, 4 PT locations in the Midwest. She is amazing. She has a well-renowned backing and known for what she can do for the human body. And her specialty has become pelvic floor, which I am so thankful for, but really it's all connected. When Brenna works on my neck and my shoulders, it helps the rest of my body and I get a better quality of life out of it. I am reaching my workout goals in different ways that are more empowering versus that mindset shift of like working out is a privilege. Working out is a joy, not a punishment. We're really working with the body for the body,
Yes.
and we're not punishing the body.
Yes. Yes. I love that. I'm a big believer in that one. Yeah. It's amazing what our bodies can do. And I think a big thing too, just even going through all the breathing exercises for anyone who is trying that with Chelsea, like it's okay if you felt disconnected with those too right now. Know that that's not normal, and I mean that in a very loving way. But if you feel like you can contract and you can't relax, like that's okay. There's people out there that can help you, and you might just need, sometimes if people come in for 1 or 2 sessions and that's it. So not even on my own, but wherever you're listening from, like if you're feeling like something's off, or if you were going through those breathing exercises and you felt like you couldn't, or you just don't even have the awareness, if it's well, I think I'm contracting or I think I'm relaxing here, but you don't know, like at anything, at minimum, leave here today knowing that you do have resources out there that can help you. And if you don't know who to reach out to, you can reach out through Chelsea or reach out to myself, and I can try to find someone in your area that I know. Because on the other negative side of things in healthcare, there's a lot of healthcare providers out there, and a lot of times there's not really jurisdiction on any of these topics either. There's no rules in the game right now of specific certifications or qualifications that you have to see pelvic floor patients. So with that being said, I invite everyone always, with whoever they're seeing, whether it's physical therapy or their family doctor or whoever, that ask your provider, ask them their why. If you're asking them a question and they tell you no, why are they saying no? If they're saying yes, why are they saying yes? And if you can't get an answer from them that's a legitimate answer, then I'd probably find another provider who is going to give you the information and the resources that you need. And I think it's a lot more complicated than just that, but I think to keep it basic with most of my patients, that's normally the advice I like to give is your providers or whoever you're having help guide you from a health and wellness standpoint should be able to give you answers and give you the support that you need.
Mm-hmm. Or, I think you said, and the support you need. If they don't know the answer, they're going to refer you on to somebody that will know the answer.
Right.
I've heard Brenna say it multiple times. If anybody says that they got it all figured out, run. And I believe that too. It just, nobody has it all figured out. We all are given our piece of the puzzle, and so fascinatingly so, all of our bodies are made up differently. What might work one way for somebody else will work differently for another. While we have this common human condition of being human,
Yes,
there are some similarities that run along the bodies, but there are a lot of nuances, and I just, having that space to not have to do it alone, and know that they have created specialties around this information, not because it's not needed, right? It is needed. And we are all humans. We all have a pelvic floor. It's all connected to our jaw, all the way back to, cell division is in embryonic states. That's fascinating. And I love too what you said about the muscle toning. Our lifestyles. I mean, from driving, the way that the automobile seats are set up, they're putting our knees above our hips, and that's not helping with our psoas condition. When we have our psoas connects from our lower body to our top half of the body. In yoga, we call it the muscle of the soul. So it's very deeply seated and can store a lot of emotions. But on the physical side of things, when we are sitting, our psoas is really contracted. And when that psoas contracts, we are getting a compressed low back. And low back pain is like the number one workman's comp claim across our nation. I don't know about overseas or above or below, but I know in the US that it is the number one thing. And a lot of people don't even know they're carrying chronic pain. They have dissociated from it because that's just the way it is. And by the time your body's actually experiencing pain or symptomology that's requiring a doctor's visit, damage has likely already been done, right? So while some things may take a visit or two to, I mean, every time that I've left Brenna's office, I've felt better. I think one time I felt extra stiff. But that was just once. And honestly, that was on me. What's really great about being in this practice with Brenna is it about the autonomy she gives you, right? She's gonna make sure that you're set up right in a way that's comfortable for you. And in that session, I wanted to do, no pain, no gain. If I do more, I'll feel better and release more. And that's not always the case. If you are clenching and just trying to brace to release, and this can be things like even deep tissue massages, right? If you are clenching to take that deep tissue pressure, you're causing tension elsewhere and you're displacing the tension that you're trying to get rid of, yes, but you're not getting at the root and not getting the removal of it. Do you have anything to add on those little tidbits?
Oh, I think you said it good.
Oh, yes.
Yeah. Yeah.
It's good. The terminology, I'm always fascinated by the science side of it, but when I go to explain the science side of things, I am always just like, maybe I'm just like the sponge that likes to know it, because those are not my words. So I
There's
guess
a million ways to explain things too. So
it's so
yeah,
true.
yeah.
It's
Had to come up with lots of different analogies.
which is what's fun about these conversations too. You've got two different perspectives that are just, I mean, she named her company Next Gen PT and Wellness, right? She is looking at the whole person. She is looking at the whole body. And that is how I've been treated every time I come in here. Like, what's the root cause and how do we get the whole body feeling better? And if it's in my shoulder, really tracking where that pain's coming from. Because sometimes where you're feeling the pain isn't where the pain is actually being caused from. Sometimes things can pull over one way and cause an imbalance, but the pain's on that opposite side. So it really is having somebody there that is trained and knows the mechanics of the body and how to support it in its greatest wellness. But it does require that communication, right? Brenna puts on her website that it's a collaborative team event, right? We're gonna talk it in. We're gonna figure out what works, and if something doesn't work, we're gonna talk about it, and we're gonna pivot and adjust as needed. And I don't know. I'm just so thankful for the time that you spend with me on my things, but also the time that you're taking here to talk to our audiences and get a little bit more information out about these things. As always, you are welcome to reach out to either one of us on our social medias, put something in the comments. We are going to do a series of conversations. So, your input, your questions, no matter how off the wall you think they are, we're here for them.
No,
right?
please ask questions. This was 100% surface layer
Yeah.
discussion here.
I want to talk about sex.
the old pictures that were always in like the administrative room. It was like the iceberg. That's only picked up like that's where we're at today. Like there's a lot under the sea yet to talk about.
Under the sea.
Yes. If anything, like we just and I tell all my patients this because the ones that ask like, well, like how can we change this? How can we grow? How can we like normalize the topic of all these? And I think in the short term, the best answer is like we just have to talk about it, right? Even if it's ourselves or talking to our girlfriends and our family members. I've seen the most growth in my business just from word of mouth. So, and that's just people telling other people. And right now, like there's a lot of barriers to fight against with just society and how we've evolved as women. We all know it's not up to speed to where it needs to be. I mean, that's just matter of fact at this point. But we're gonna fight that to some degree. But the only way that we can change is to keep talking and to keep growing and to keep just pushing the agenda forward. So the more that you can talk, the better, and at the end of the day, if you're having any sort of issues, like we can laugh about it, but also just understand it's not normal. I don't care if you've had 10 babies or no babies at all. Like peeing your pants is never going to be normal. Having pain is never going to be normal. And don't feel like you have to live with the symptoms that you're having. There's help out there.
Right. And I think about it when we take the best care of ourselves, we are better for those that we love that are around us. Our relationships with others get better. Again, even back to intimacy, right? If we're having pain during intimacy, we're probably not going to be as intimate as we would have wanted to be, right? And our partner's going to feel that. And we can't help but be human, right? And whether the partner internalizes it, it's like, oh, well, did I do something? You know, it can create this barrier and tension where if we can just break through the ice, right? And say, you know what? Actually, that doesn't feel so great. Or I prefer when you do this. I've learned so much about myself and in beautiful ways that have made intimacy better by being able to express, no, not this, no, not right now, no, not that, but yes, this. And it really took the safety, right? And when you come into Brenna's office, you're able to talk about those things. And then maybe if you're talking about it with your partner, it's not as hard, right? You've practiced, you know, that awkwardness, like, oh, well, okay, this is what happens, right? When this happens. And um we normalize it, right? Like,
and they might not know. Your partners don't know. I think a lot of just explaining your feelings and symptoms, if that's right for you. You know, I'm not telling you that you have to, but I think a lot of issues could be resolved in that way, just with better communication. Which I get it. It's hard. It's hard to admit that some of these things are going on, but I not to call it any guys out there, but I think a lot of them don't understand some of the symptoms that we can be having, and vice versa. I treat men too, so I see it on the flip side of that, and it is, it's something that we just need to keep talking about.
Right. So that's what we're going to keep doing is we're going to talk about these things. We're going to invite you to feel into your body, both physically with your breath, emotionally, because the body does keep the score. When you're holding on to those tensions, they likely resulted from somewhere, right? And being able to release it in a safe way that's going to bring you more like vitality and longevity to your life, and make, it's just so draining and tiring to be in pain. And a lot of times people don't know they're in pain until they get the relief. They're like, oh, okay. And then we learn that right, the pain is not normal.
Mm-hmm.
It may be the status quo, but it's not normal.
Mm-hmm. Pain can be helpful. It can be a warning sign, but chronic pain and persistent pain shouldn't be there, and you don't have to live with that.
I'm so thankful for what you do. We're gonna dive deeper next time. Again, we can't embarrass Brenna. And
you really can't.
I really can't. So if you guys have,
please try.
Yes, right. Yes. Okay. Good. Yeah, because we want to talk about these things.
Ask us the questions that you don't feel like you can ask. Yes. I promise you can ask them, okay. And we will answer them.
We will.
Yeah.
And it's fun because we did not script this. This is all candid conversation. So if you do have questions that come up, yes, we'll have them. We'll know what they are, but we're going to come and just speak from our hearts, speak from our knowledge, experience base, and give it all to you raw and real, live. Puns intended, just kidding. Closing out today, Brenna, thank you so much.
Yes.
You can find Brenna at Next Gen PT and Wellness. She is on, for sure, Facebook,
Instagram, and a very non-updated website that we joked about earlier.
Yes. There's some good information on there.
Chelsea's like, you need to update your website. You're correct.
She's had a couple extra kids since her last website update. And she's a little bit modest in all of her credentials. She's like, oh, I've done some, CEs, and but she's very real about wanting to help people. And I've experienced that firsthand. That's why we're having this conversation in the first place, because I trust you, and I would trust referring you really to the people that I love the most. And yeah, cool. Yes, how fun. I think that's all I have for you today. Do you have anything else you want to end with? Anything you want our listeners to maybe practice or not practice? Because sometimes inaction is action.
Yeah. No, keep working on the breath work. I always joke with Chelsea that she's like the easiest patient to work with because she knows how to breathe. And hopefully a lot of you listeners are kind of experienced in that too. If you can breathe well, you can get your pelvic floor going well. But again, if you're you might just need a little extra help, and that's okay. But keep working on the breath work that Chelsea went through today or anything in the past, and try to start to consciously connect that into your pelvic floor. Can you feel with that nice deep inhalation, can you feel your pelvic bowl kind of gently expand and relax? Because when you get pressure on that muscle and it expands, that should be relaxation there. And then with that exhale coming, can you appreciate that rebound of the pelvic bowl happening? Just try that out too, and maybe that can be something we can touch on the next time we meet up. But see how people are doing with that, and can you do it? And maybe the simple answer is just like, okay, I get the breathing, but I don't feel anything with my pelvic floor. And then that's something we can dive into too.
Yeah.
But hopefully that makes sense. I'm a visual person. The bowl.
She has you have a model to bring next time, right?
Yes, I will bring my pelvic floor model.
Yes. Okay.
Yeah. Look it up. Look up it on a Google image of pelvic floor muscles, because that's another thing too. It's like we say pelvic floor muscles and think everyone's just like, oh, it's this one sling of muscle. Like it's one muscle, and it's like there's a lot of muscles there.
That was so surprising. And I appreciated like experientially learning that. I was like, oh, okay. And just like the release, so good. I know you have sometimes patients come in with their kids and they'll be like, Mom, why are you getting needles in you? I asked Brenna, I said, I want to know who was in so much pain that they're like, we're going to shove a needle in there and hook it up to a little electricity and everything's going to be fine. Somehow it is.
I like to believe, I don't know exactly, but I was one of the first ones that went through the certification for the pelvic floor needling. I was the first class for that. And I never really asked, but I'm assuming it came from a good place, that it's like, well, we know the needling's really effective for this muscle, so why wouldn't it be effective for the pelvic floor? And like, good on them, because again, we shouldn't be treating the pelvic floor muscles like they're any different from the rest of the muscles in our body. So hopefully it came from that standpoint and not out of
well,
crazy curiosity.
Well, and in dry needling in general, what you said has been around since about 2012.
In at least I can speak on from a Nebraska standpoint, and this would be like city Nebraska, so Omaha, our only city, Omaha, Lincoln. It was just starting to get very popular from a muscle standpoint in about 2012 to 2015. So like we're well past that. But we just know we can use the dry needling and other types of needling for more than just muscles now. So that's exciting.
It's so fascinating. So not only online can you find Brenna, but also online. Brenna has an app. You can join. You can work out with Brenna and her crew here at Next Gen. But you can find her in Yankton, South Dakota, Niobrara, Nebraska, Verdigris, Nebraska, Norfolk,
and soon to be Bloomfield.
That's why I told you she's a go-getter. And I'm so excited because she is coming back to the Midwest with these modalities that, as we know, things take a little bit extra time to get here in the Midwest, and we love that, right? We love the slower pace of life. That's why we live here. But it's so amazing to bring back some of the things that the bigger cities have known about for longer than us, but we're just starting to apply here now. So thank you for being a pioneer. Thank you for kind of reaching out in all the directions. And we're going to try to make Brenna's cheeks turn red next time. We'll see if it works. It'll probably be fine, though.
I'm very pale, so that doesn't take too much, but might externally look flushed.
Tis the season.
Yes.
All right.
Okay. Thanks for having me.
Absolutely. We'll see you next time on this series with Dr. Brenna Sokol with Next Gen PT and Wellness. Until next time, this is YogaPodClass. Namaste.